My name is Rini Mahalik, and I am the Firelands community outreach person here. And in my role, I wear several hats. I wear the hat of the Firelands 55 Plus Club, and I also wear the hat of the Speakers Bureau. I have a really fun job, and I get to bring to you different expert speakers on the topics of health and wellness. Today we're bringing to you Tina Ammanniti, and Tina is the director of our cardiac catheterization lab here at Firelands. She is also the chest pain center coordinator. And Tina is going to talk to us about a very important topic, which is recognizing the early signs of a heart attack. Now, these next 5 minutes could be life-saving. So again, we thank you for being with us today, and we hope to see you next month.
Hi, did you know by the time you get done watching this video, 6 people in the US will have had a heart attack? Yes, that's right. Every 40 seconds in the United States, someone experiences a heart attack, which helps lead cardiac disease as the #1 cause of death. My name is Tina Ammanniti. I'm the director of the Cardiac Cath Lab and Chest Pain Center Coordinator here at Firelands Regional Medical Center. And I'm here to tell you about the warning signs of a heart attack and what you can do to save a life. Your heart is a muscle about the size of your fist that sits just left of center in your chest. While its job is to pump blood throughout the body, it gets its own blood through the coronary arteries. A heart attack happens when one of these coronary arteries becomes blocked with clot or plaque and disrupts the flow of blood to the heart tissue. This heart tissue then begins to die. The longer the coronary artery is blocked, the more damage to the heart tissue, causing the heart to become weak and not able to pump blood as well, or even death. This is where the saying, time is muscle, comes from. As an accredited chest pain center, our goal is to get you to the cath lab and get that coronary artery open in less than 90 minutes. This is where you come in. The first link to starting the process is recognizing that a heart attack is happening. There are signs and symptoms that often go unrecognized or ignored. The tricky part is not all heart attacks happen in the same fashion. Some people have multiple symptoms, some people just have 1 or 2, some have very vague symptoms or none at all. So let's explore the signs and symptoms that get you thinking about your heart. #1 and most common is chest pain. It can be sharp and stabbing or dull and just all over. Some people describe it as a squeezing or a band around the chest, or a pressure or like an elephant sitting on their chest. This can be constant or it can come and go. #2 is a numbness or discomfort in other areas of the body. This is often seen as an extenuation of the chest pain going down the arms, up the neck to the jaw, teeth pain, back pain, or even stomach pain. #3 is cold sweats, or what we call diaphoresis. This is an excessive abnormal sweating all over the body. #4 is nausea or vomiting, or an indigestion in the stomach area, often not even related to the chest pain. #5 is a sudden onset of shortness of breath, or the inability to catch your breath. #6 is palpitations. It's a rapid, irregular heartbeat that some people describe as feeling like a heart is beating right out of their chest. #7 is dizziness or lightheadedness. It's an unusual weakness or a foggy feeling in their head. If you or anyone around you is experiencing any of these symptoms, it's important to recognize that starting the sequence by calling 911 can save a life. By calling 911, the paramedics can activate the system by performing an EKG that they send to the ER of a hospital that's capable of treating heart attacks. The ER physician then notifies the cath lab and they begin to get ready. While transporting to the hospital, the paramedics will give appropriate medications and they're available to treat any life-threatening events that may occur. By the time the patient reaches the ER, the process is well underway and an expedited trip to the cath lab to open the coronary arteries and save a life can happen. Often, people delay seeking treatment for fear of a false alarm. Even if that EKG is not a heart attack, it's important to get those symptoms checked. This could mean you have coronary artery disease that needs taken care of before it becomes a heart attack, or it could be some other underlying disease that needs treated. Thank you for watching, and please remember to visit your primary care physician regularly, and don't be afraid to ask them what it takes to keep your heart healthy. Have a great day.